So a ring block is a very effective way of making the whole of the finger go numb so that you can carry out any procedures you need to. First thing that I'm going to do is to sterilise the area that I'm working with, and then we can talk whilst that's effective. It's really important that you do this with long enough for it to take effect before you put the needle through the skin. So you want to have cleansed the skin and allow it time to take effect. I'm going to do this with bupivacaine with adrenaline. Don't forget to check the expiry date, and I've got 10 mils of it drawn up already. Bupivacaine is long-acting. It used to be thought that it took a lot longer to come on than the lidocaine, but actually that's not the case. There's very little difference in the time to starting to take effect between bupivacaine and lidocaine. So therefore it seems kinder to give the patient something that will give them longer acting pain relief afterwards by using bupivacaine. Adrenaline, again, there was a myth that you couldn't use adrenaline in end arteries, which the digital arteries obviously are. But there have been thousands and thousands of ring blocks done now with adrenaline in, and there haven't been any significant problems from that. There is, however, approximately one case every year where someone has used an inappropriate finger tourniquet and forgotten to take it off after the procedure, with the result that the patient's finger dies, which is not good news. So actually I would recommend that you do use adrenaline because it's safer than using a finger tourniquet. Okay, so that is all, should be all nice and clean now. So I take the patient's hand in mine, and if I just turn the hand over for a moment, I'm going to place my finger there. So I've got the index finger of this hand placed underneath the web space between the index and middle fingers. Obviously it's the index finger that we're going to block. The reason for going in through here is that this is a less sensate area than many other places on the hand, so that then the discomfort of the needle going through the skin is less than it would be otherwise. So go through the skin in the web space and advance the needle until you can feel it about to come through the skin on the other side. And then suction back to make sure that you're not in a vessel, and put the anaesthetic in as you withdraw. You need to have warned your patient beforehand that this does sting, because the chemical of the anaesthetic is very unpleasant as it actually goes in. Keep withdrawing, and you keep withdrawing as you're putting more and more of it in. And you can see the web space is now bulging as the anaesthetic is being put in just underneath the skin, and turn your needle slightly. You want that bulging to continue until it's hit the midline of the finger, and then you know that you've got good dorsal blocking as well, without having had to put the needle in through a separate place. The index finger, it's much easier to do a ring block in a finger that's got a web space on either side. The index finger is a little bit more difficult because you've not got the equivalent on here. So unfortunately this side is slightly more uncomfortable because you don't have the benefit of a less sensate place. But the idea is similar. The needle goes in through the dorsum, put it in until you can feel it from this side. Aspirate, make sure you're not in a vessel, and put the local anaesthetic in as you withdraw. And you can see that bulging is just about reaching the midline now, so I know now that I've got anaesthetic from this side to here and from this side to here, so that should give a complete ring block.